Conditions that predispose to kidney disease are prevalent in Uganda, with hypertension standing at 26.4%, diabetes at 2.9%, 18.6% for overweight, and 3.6% for obesity. A recent study for non-communicable diseases in the Wakiso district of central Uganda uncovered the prevalence of chronic kidney disease, putting it at 21.4%. Unfortunately, this prevalence is met with a challenge of limited provision of dialysis services in the country.
There are only 8 doctors that are trained to manage kidney disease and to train others. Because we are a population of about 40 million, that means each doctor has to see a line of 5 million Ugandans. This is very much impossible, and I think we need to have intervened as early as yesterday. There are only 50 nurses that are trained to take care of kidney patients. This figure does not help in any way, and the training opportunities are really bleak. Yet there are many there, and our country on its own has the potential to actually train its own doctors.
The service itself is not cheap in the health centers where it is availed. This affects both adults and children, who sometimes, after all options have been exhausted, only stare at one thing: death.
I must emphasize that when the kidneys fail, there's little you can benefit from in terms of drugs. We can restrict what you eat, how much you drink, which drugs not to take, but you cannot make your body filter the toxins that are not getting out. That little child that needs an intervention that will last one day will definitely be faced by death if it is not addressed.
It may not be a low-cost venture, being that 560 million shillings is required for each regional referral to set up a kidney treatment center. However, 8 nephrologists, as the figure currently suggests, are not enough to serve over 40 million Ugandans seeking both treatment and testing for kidney disease. This is why members of Parliament sitting on the Health Committee want dialysis services availed across all regional referral hospitals in the country.
I am praying to government that we increase financing for kidney care, because it is a big problem. Many of our people are dying, and we need to speak up so that we are able to come up with solutions. And the second one is regionalizing the services, especially for the grassroots person who is not able to move to Kampala, to move to Mbarara. You realize all the services are just Kampala and Mbarara. So what about someone who gets a problem in Soroti? What about someone who has a problem in Gulu? What about Karamoja? So all these areas, if we can have the services regionalized, will make it easier for our people who are faced with a problem to get treatment, to get help.
We really look forward to government helping us and helping the public, and in particular the kidney patients, because our patients have to travel very long distances to come and access this service.
But as government ponders on what could be next for an ailment that sounds deadly, the public have a role to play through embracing preventive mechanisms.
So we're looking forward to step up against kidney diseases. We're looking forward to fight kidney diseases using advocacy means for the use of prevention means, and that's change of lifestyle, change of what we eat, intervention like early medical seeking in hospitals, and also engaging any other stakeholders to come up to the fight against kidney diseases.
More of this will be known on the World Kidney Day, slated for Thursday, 28th March 2019. In Uganda, it will be observed at Parliament as part of the Parliament Health Week under the theme, Wellness is My Choice. Henry Okurut, UBC.